Good morning, and welcome to Ask Dr. Murphy, This Week in Public Health. I hope everyone is doing well this weekend. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to introduce Dr. Robert Murphy. Dr. Murphy, how are you this weekend?
Doing well. Sorry, we're doing this a couple days late, but I was just at a wedding in southern France, which was really hot.
Very hot, and we're glad we get to have you this week. So, as you know, Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing the latest headlines through today, August 9th, and we welcome any questions or comments down below or at any of our linked social media. As a reminder, if you'd like Dr. Murphy's sources straight to your inbox, you can sign up for his Substack for free, link in the description. Starting today with a big update on the Cyclospora outbreak here in the US. Can you bring us the latest, Dr. Murphy?
Yeah, this thing is really getting out of control. Over 22,000 suspected or confirmed cases in 47 states. It's essentially everywhere in the United States. It's a parasitic infection that causes bad diarrhea. It used to be mandatory tracking. The CDC mandated that. They took it off the list a few months ago, but some states still did it, like Michigan. And Michigan is we really should credit Michigan for getting this thing back on track. Because the longer you delay one of these things happening, the many more cases you're going to have. The same is happening with Ebola. You know, they got delayed because they had the wrong test and so on. But anyhow, we now have all these cases, and including, unfortunately, 2 deaths occurred in some seriously ill people who had other underlying diseases. But still, you know, they typically say, "Oh, this is self-limited disease; it can't kill anybody," but that apparently is not the case. So, and then of these 22,000 or so, 517 have been hospitalized and 279 of those are in Michigan. Michigan is really reporting the most, and a lot of that is due to their good reporting. So, yeah, that's the story on cyclosporiasis. There's really nothing else new. It's still linked to chopped lettuce, and people really need to be careful, particularly anything from that Taylor Farms. But I think that's pretty well known now, and those products have been taken off the market, but there's still lots going on.
Yes, and those 2 deaths, unfortunately, were those individuals were sickened before the recalls happened. So can't say definitively that they were linked to those products, but as we know, the FDA is still looking for additional sources. But you
And
mentioned it that
new cases are going down in areas that have done all that, and even in Michigan.
yes, and that is part of the good news. But you did mention Ebola there in our first segment, and that is our next story. More
Mhm.
cases and some vaccine trials going on. Can you bring us the latest?
Yeah, some more somewhat good news here. So Ebola is now almost 4,000 cases with almost 2,000 deaths. It's on a trajectory to be the worst Ebola outbreak. However, Moderna, the vaccine company, has started a phase 1 trial. That's an early phase trial with one of their new Ebola vaccines. So this is really good news because they're going to be making a minimum of 500,000 doses of this vaccine. So the area is still pretty localized to Eastern Democratic Republic of the Congo, DRC. And if they can just vaccinate everybody in those areas, you know, this thing will extinguish itself. So that's good news that that's coming along.
And some more great news from Moderna is that there is an official approval for one of their vaccines that could be available this fall. Can you tell us about it?
Right, the flu vaccine, the typical flu vaccines made with this egg process and stuff, and you know, very old technology. Moderna makes the RNA vaccines that we know from COVID and also now in Ebola, much kind of easier to make and typically more potent. So they made a flu vaccine. They tested it. There was a lot of controversy there. They did studies with, you know, tens of 40,000 people. And so it's got approved for people 50 and over. They're doing more studies in people 65 and over who typically do even better with that. The interesting thing about this mRNA flu vaccine is that if you look at the immunologic response to the flu that it's directed at, it was 27% better than the standard vaccine. So we don't know if that really translates to a clinical benefit or what, but it's a good sign because that's what you need. You need those antibodies to prevent, serious disease, at least, if not preventing the whole thing. I'm going to look for the Moderna vaccine this fall myself. So I believe in these data. I think it's good.
Yes, and I'm hoping for that age range to be expanded so that I could get it as well this fall. But if not, the protein-based flu vaccine is still a great option. Now,
And
looking,
maybe egg prices will go down if everybody switches over. So
yes, a great unintended side effect there that would be awesome. But looking more at the broad US response to emerging diseases, we got a report from the Government Accountability Office on the US Department of Health and Human Services. Can you tell us a little bit about what that office is and what they're saying?
yeah, you probably heard of this before. That it's the GAO is typically what it's referred to. As you said, Government Accountability Office. It's a nonpartisan part of the government that just kind of evaluates how things are going. It is not a political organization. Basically, what they've urged, and they can only make recommendations to the government. They don't have no other power other than this reporting and recommendations that the U.S. Department of Health and Human Services, DHHS, needs to improve its cross-agency coordination on emerging infectious disease surveillance, like cyclosporiasis, like Ebola, like many other things that are happening now. And they're basically telling them and giving them a roadmap of how they should coordinate the efforts of all these people looking at these things. Because the United States government is still massive. And then we have all the state governments. How is all that data going to work? I think the cyclospora problem is a great study of how badly things actually can go. If it wasn't for the state of Michigan, it would even be delayed further. Let's put it that way. So I think it's a good thing that you be more efficient and work better.
Absolutely. And on that note, we do have some data from 2024 about West Nile and Powassan virus. Can you bring us up to date?
Well, people have probably heard of these diseases. It depends where you live and how much time you spend outside. But West Nile virus is the most common arboviral disease. So in the United States right now, and the problem with it is it can cause severe neuroinvasive disease. That's like encephalitis. You end up in the hospital, high rates of hospitalization, nearly 1 in 10 cases actually with this neurologic problem can die. So it's very serious. And there's West Nile virus in Illinois and Michigan and Indiana, all around the Great Lakes. So it is something that we have to be careful of. Powassan virus is much less common. It's a rare tick-borne disease that reached a high of 60 cases in 2024, and 9 of those people died from Powassan virus. So this highlights this continued public health importance of both of these viruses and reinforces the need for mosquito and tick prevention, as there's currently really no approved vaccines or treatment for either of these diseases.
Yes. So very good to be up to date and know about those. But something much rarer that was quite surprising is that there is suspected tularemia. You'll have to help me with that pronunciation. Tularemia, thank you,
Tularemia.
cases in New York. Can you tell us about it?
Yeah, tularemia is often referred to as rabbit fever. And it's a rare but serious bacterial disease that's recently drawn attention after 3 probable cases were reported in Suffolk County, New York. That's on the eastern end of Long Island, where all the rich people are and stuff, but they're all vacationing out there right now. And the infection is most commonly threaded through bites from infected ticks or deer flies. But people can also become infected through contact with infected animals, contaminated water, or by inhaling contaminated dust. does not spread person to person. So it's just another thing to worry about if you're vacationing in a place like Suffolk County. It
Yes.
responds to antibiotic treatment.
Yes, just very rare to see that. So we will keep up to date and see if anything more comes of that story. But we have two final stories today that are both great news. First is that there has been billions of dollars restored to public and global health funding. Can you tell us about it?
Yeah, this is some really great news, very positive. You don't hear too much about it, so I want to really, that's why I really want to mention it. So the US State Department, under former Senator Rubio, committed nearly $2 billion in renewed global health and humanitarian funding. So this funding had been approved, taken away, and now it's given back. It includes support for childhood immunizations through Gavi, big vaccine group that gives a lot of vaccines, nutrition programs, TB control, Ebola response, and humanitarian relief. And so this is really good news. It's unfortunate it was withheld for so long, but hey, we're going back in the right direction, and that it's clear now that things like Ebola and the like require strong international collaboration, and that multilateral organizations have to remain essential partners. So this is a good step back into the we're going to collaborate globally effort.
Yes, really, really great news. And finally, hopefully, some stabilization coming at the CDC as the Senate has confirmed a new director.
Yeah, Dr. Erica Schwartz is now the official director of the Centers for Disease Control. They've been without a director for over a year. She was the former Deputy Surgeon General and Coast Guard Chief Medical Officer, and she pledged to prioritize scientific integrity, transparency, and public trust while leading the CDC through infectious disease threats and agency rebuilding. So people expect a lot from her, and I think in general, everybody is very much in favor of her appointment.
Yes, so good news there. And on that note,
Good
I'd like
news.
to thank you, Dr. Robert Murphy, for your expertise bringing us up to date on all that is happening this week in public health.
Well, thank you, Katie.
And thank you all for joining us again on this special weekend episode of Ask Dr. Murphy. We will see you again next week and enjoy the end of your weekend.